Hi, I'm Dr. Adonis with Living Well Integrative Health in Northfield, New Jersey. Today we're going to go over self-massage of the forearm flexors and extensors for those of you who are experiencing golfers or tennis elbow, or even some of you who are having some wrist problems, you CrossFitters out there. Okay? Today, the tools that we'll be using are going to be my Mobek massage gun. As well, I'll be using factor tool. And whenever you're using instrument scraping, you're going to need a Molink too. Okay, so I'll include those links on the bottom of the video if you want access to those tools. Okay, so first of all, the heads that you're going to use is either going to be the flat head or what I call the drill bit. The reason being is the muscles of the forearms are really small, sometimes no bigger than your index finger. Okay, and for those of you who are under the age of 18, like I have a 10-year-old who uses this, it could be even smaller. So you're going to need a very specific contact point when you're doing this. So today we're going to be using the drill bit. What I would do is have it on low setting, however way your massage gun works, merely because whenever you're having these issues in your elbow or wrist, these muscles will be really inflamed. So we're going to start out by working on the brachioradialis, which is this muscle right here. Okay? So you're going to start closest to the elbow joint. And what you're going to want to do is you don't want to have a direct contact pushing in because that's really tender. Okay? You're going to kind of want to have the contact point parallel versus perpendicular. And then what you can do is you can raise, what you can do is you can lower or increase the angle closer to 90 degrees depending on your tolerance of pain. So you'll want to have more of like somewhere like a 45-degree angle on here, okay, because these will be really inflamed. So the first muscle we're going to do, like I said before, is going to be the brachioradialis. Okay, so you're going to start where the attachment point is at the elbow, and you're going to slowly work down. I'm going to flex so you can see that muscle. For those of you who are coming to my office, we'll have already KT taped you, and you'll have, all you do is follow where the tape is, because that will be the involved muscle. Okay? And you have the other extensor on the outside, closer to the lateral part of the elbow. And you work it all the way down, close to the wrist. You don't go in on the wrist. There are no muscles there, okay? Now we're also gonna start working on the forearm flexors. What you're gonna do is start more medially, and once again, what you're gonna do is you're gonna have like a 45-degree angle, and depending upon your tolerance of pain, you can move it up to 90. Or somewhere in between, and you're just going to move right down that fascial line. Okay? Things to note, you will feel some sensations in your hands, okay? And all that is basically the muscles up here actually control the tendons down here. So you may, as you start to release these muscles, you may get some extra feeling here, or a sensation of hot, which is just increasing blood flow to these areas. Okay? Now, we'll be moving on to using my factor tool. Normally what you'll do, I won't do it now, but just like a butter knife, you'll scrape up some emollient. And what you're always gonna do is you're gonna wanna scrape up towards the shoulder, towards your lungs, to get rid of the inflammation. This one, you don't really have to worry about the angle of the tool. Okay, what you do have to do is make sure that you have enough emollient, or else you're gonna flay yourself and skin yourself, and that's not so good. It's normal for the areas to be red, okay, because that means there's more blood flow going there. Things to be aware of. Be aware of any open cuts or lacerations, you're not going to want to do that. Okay? Any questions? You can reach out to me at askdradonis@gmail.com. Remember, being in pain and weak is a choice. See you on the other side.